Infamous extreme cold has finally arrived, and it's no joke if you are stepping outside today.
Yeah, joining us from Park Nicollet to discuss frostbite and other cold weather injuries is Dr. Larry Richmond. Good morning.
Good morning.
So let's talk frostbite numbers first. I'm sure you get a lot of these every January. What's the typical number that you would see in an average January or an average winter?
Sure. So in a typical winter, it could be 15 to 30 serious frostbite injuries. That's at Region Hospital alone.
Okay.
So depending on the severity of the winter.
Okay. And now what describe exactly what you would experience from frost nip versus frostbite, because I know there's a lot of people out there that have no idea that there's this thing called frost nip, which is basically a less severe version of frostbite.
Sure. So the milder symptoms would tend to affect both the fingers, toes, parts of the face, the nose, the ears, and that can be painful. The skin can turn red. It can become numb as well, and that's your warning to really get inside.
That's for both frost nip and frostbite.
Correct. Okay. When it's getting more serious, it can become very painful or numb. You can notice more color changes in the skin where it becomes lighter or even starts to blister. At that point, it is very serious, and you need potentially to get medical attention. Certainly warming up is the first step.
So what is the difference, though, between frost nip and frostbite? Do they have the same symptoms?
Frost nip is a very early stage. Frostbite is sort of the middle stage, and actually frost burn is when it's very severe. That can cause permanent damage to fingers. Sometimes people lose parts of their ear, unfortunately, in extreme circumstances. People have lost toes. So the extreme extremities are very vulnerable to this.
So what should you do immediately if you think you might be at risk? At what point do you try some home remedies, and at what point do you go to the hospital?
Sure. The most important thing is to get inside, get warm. Things you can try would be to run warm water on your hands, for example.
And that can burn if you're real cold.
Yes, warm but not hot water.
Right.
If you have any wet clothing, you want to get that off if there's been, an incident where you got wet outside. And at that point, it really depends on how you're feeling. What is your overall health? Not a bad idea to call somebody if you suspect you have a serious frost injury.
Now, clearly, this is obviously preventable, but there are some better things to do than others. For example, we were actually talking before we went on, and I had no idea that mittens are actually more warming than gloves. I didn't even know that.
That's right. So I spend a lot of time outside in the winter. I love exercising outdoors. I've found that using mittens will keep the fingers together, and there's a lot more shared warmth that you can get from that versus having gloved hands.
You also brought some other things that you recommend, I mean, as far as covering the ears, covering the face.
Absolutely. Face mask, a really warm hat, and layers. So layers, sometimes I'll have 2 sweatshirts on, sometimes 2 windbreakers if it's windy outside. Wind is a very important factor when it comes to frostbite.
Moral of the story, you can't have too many layers today. All right. Thank you, Doctor. We appreciate it very much. Stay safe out there with your own outdoor adventures.
Yeah, and stay warm today. Do the best you can. And, again, mittens. I had no idea. It's kind of cool. I'll have to go out and buy some now.
I swear by them.
Well, I should start listening to her more often, I guess.
That's what I've been saying for a couple years now.
We're not talking.